Hello, I'm Sophie Scott. Welcome to Health Watch. When it comes to excessive drinking, Australia is world class. The nation's first long-term study of alcohol abuse has found that 1 in 5 drinkers is likely to develop a problem during their lives. But despite the statistics, very few people realise they're in trouble, let alone seek help. Australia is a hard-drinking country, but that love of alcohol is starting to bite. For the first time, researchers looked at lifetime rates of alcohol abuse.
We found that 20%, 1 in 5 Australians have a problem with alcohol at some time in their life, that these rates are some of the highest in the world.
Alcohol abuse doesn't relate to how much people are drinking. Instead, it refers to the effect it has on their lives. Despite the high incidence of abuse, very few people seek treatment.
We live in a culture where it's accepted and it's a rite of passage to get drunk and to have problems with it. They don't own up to it because of the huge stigma involved in owning up to it.
The review found a third of men had problems with alcohol. Of those who drank, half suffered depression or anxiety. And the biggest jump in heavy drinking was men in their 20s.
Dad would kill me if he knew.
Health experts say they're under no illusions how difficult it will be to encourage people to reduce drinking. Raising taxes on alcohol has been shown to work, but they admit it's unpopular.
Tax on alcohol makes it more expensive and people will drink less. And instead of having 10 drinks, their pocket will be empty out after 5 or 6.
In the meantime, they encourage those who have a problem with alcohol to get the help they need. There's a new warning for young people against using sunbeds to get a tan. Australian researchers have found the younger people are when they start using solariums, the more likely they are to develop life-threatening melanoma. Melanoma is one of the leading causes of cancer deaths in young adults. The researchers say dozens of lives could be saved each year if young people stayed away from tanning beds.
Despite all the warnings, more than 40 Australians die from melanoma caused by sunbeds each year. Many of them are young. For the first time, Australian researchers have looked into the link between sunbeds and melanoma in people under 40, and the results were clear.
And we found that people who had used a sunbed were 40% more likely to develop melanoma.
The risk is even higher when people start using the beds at an early age and use them often.
People that were aged less than 20 when they first used a sunbed, or people that had used a sunbed more than 10 times, they both had approximately a 2-fold higher risk of melanoma compared to those who'd never used a sunbed.
For melanoma patients aged 18 to 29 who had used solariums, about 3/4 of all melanomas were directly linked to sunbed use. 34-year-old Jay Allen first visited a solarium 5 years ago and knows all too well its effect.
I had a mole on my left ankle that came back a melanoma 1.95 millimetres deep. And then after a few operations I found out that it spread to 1 lymph node in my groin.
The World Health Organization has re-examined the evidence and recently put sunbeds at the highest cancer risk category. That puts them up there with tobacco smoking.
We've got to get the message across that the suntanned look is not a cool look. In fact, it could be quite harmful for you and even cause your death.
Let's ban them. You know, there's just no need for them.
Jay Allen's cancer is gone for now, and he's campaigning to stop others having to go through what he experienced. The researchers estimate 16% of melanoma cases aged 18 to 29 could be prevented in Australia by avoiding sunbed exposure.
And Sydney researchers have found that having a fracture due to osteoporosis can be as devastating as diabetes or arthritis. The study found women experienced a significant reduction in their quality of life. Another reason to keep your bones strong and healthy. That's all for Health Watch. See you next week.